Hi, I'm Dr. Bradford Scott, the Vice Chair of Education for the Michael E. DeBakey Department of Surgery here at Baylor College of Medicine. One of the benefits of coming to the Michael E. DeBakey Department of Surgery for your training is the diversity of our hospitals, the incredible internationally renowned faculty, and the amazing experience of living in Houston, Texas.
It's an impressive physical, architectural wonder, and honestly, even being in the Michael E. DeBakey Museum, I was absolutely seduced by the legacy of Baylor, the roots of where it came from, and actually got pretty into the history of the medical center too, and how it has grown tremendously over the last half decade or so. So it is pretty cool to be here.
Hi, I'm Stephanie Gordy. I'm the program director for the general surgery program for Baylor College of Medicine. We have 3 residency tracks. We have the clinical track, which is the 5-year track. We have the research track, which is 2 years of research after the 2nd year. So it's a 7-year track, and then we have the global track.
The Bentab Hospital is one of about maybe 15 county hospitals in the United States that principally take care of people who don't have resources. And it has been a very busy service over the years, and really at cutting edge with a lot of clinical research, some basic science research, and especially heavy in areas of acute care, surgery, and surgical critical care. So it has always over the years been a favorite rotation for medical students, for residents, and faculty who work here find that this is where they really like to work.
Baylor St. Luke's, an amazing, expanding private practice situation. We've increased our operative volume there for the last 5 years, 30% every single year. Incredible experience in robotics, advanced surgical oncology, bariatrics, colorectal surgery, vascular surgery, thoracic, general surgery, surgical oncology, just an incredible wide variety of experiences. Another great experience on our campus is a rotation in pediatric surgery at Texas Children's Hospital. Massive, amazing, large pediatric hospital, one of the largest hospitals in North America. The progression through your residency, you'll increase your autonomy and your responsibility for the service. One of the great experiences at Texas Children's, you'll get to see and participate in fetal surgery and potentially congenital heart surgery. So your rotations at the VA hospital, you'll rotate through general surgery, acute care surgery, surgical oncology, vascular surgery, and we also have thoracic surgery available for rotations. Incredible experience, high volume. It's such a high volume VA that we actually do transplants. It's very unusual to see in a VA system.
In addition to an array of other new elective rotation training options, we have also added an extremely popular community-based general surgery rotation in Colorado Springs. This rotation has been so successful that 2 of our graduating residents have accepted medical staff positions in this program.
So this program is specifically designed for people who are interested in academic global surgery. And what that means is maybe a low resource location, and academic in that you're interested in education and research. Whatever your interests are, I think it's important that you know that this program can be tailored to you.
We have a number of large facilities available to you, including this one, which is a simulated operating room. In addition to that, we have several FLS stations. We have a coordinated program that is meant to prepare you for the fundamentals of endoscopic surgery exam, as well as the fundamentals of laparoscopic surgery exam, as well as a number of other exercises that we provide throughout the year, including a surgical skills Olympics, an intern boot camp for our very first year residents. And essentially, we take great pride in making sure that all of our residents get the absolute best training in surgical skills that we can provide.
So the Department of Surgery is really a jewel. It is, and we want it to continue to be first in class, absolutely the very best that you can find anywhere. We think both in terms of how we view ourselves and our national reputation, we really have achieved those goals.
The cost of living is great. The amount of money I've been able to save just on housing alone, even living right near the med center, even close to downtown, the prices are really affordable. Number one favorite thing to do in Houston is eat. I love eating, I love food. And Houston, because the population is so diverse, there is a lot of incredible food available. I mean, on par with New York City, LA.
If you play golf, we got a lot of golf courses here and a lot of land in Texas. We got a lot of golf. And if you're more into the finer things, we got all the shopping that you want. You can go and, or at least, go window shopping if you can't afford some of these places. If you're into the finer arts, we have a lot of nice theaters here. We are a part of the Broadway tour. So when things get back to normal after COVID, those things will resume.
It is okay. Thank you, COVID. But honestly, you work with so many attendings, and you all have these really awesome projects. So it's really easy to get linked in with someone, and then you just kind of have them be your mentor. So.
And honestly, it's just that the people were nice, and I wanted to hang out with them, and I liked the people who I interviewed with, even when they didn't go to this program. And
I think
your emotions. Ugh.
I think one thing I found about Baylor when I was interviewing, we all interviewed at a variety of places, like for residency. And I thought Baylor was a nice hybrid, in my opinion. I feel like you get in and you operate and you have autonomy and you have exposure and you have a lot of volume, but the academic support, the research opportunities are very robust as well.
You'll always have a buddy. It's not just like there's 3 of you in your year, and when one of you's on call, the other one's at night or something like that. You always have a friend.
I hope through visiting our website you're able to see the details of our program and all the curriculum and opportunities that each of our learners have. This is such an exciting time for our department. Our greatest day is match day. We recruit the best of the best. Our second greatest day in our department is the day that our graduates graduate and become our alumni.
When people are applying for general surgery residency, especially when they're looking at a certain tier of programs, after a while, they all start looking a little bit the same. The big surprise for me was my exposure to transplant as an intern and the level of support and the level of mentorship and guidance that I received. And that just opened a door to something that has been fantastic and spectacular, and a career beyond anything that I could have imagined.
You have a ton of autonomy at Baylor. I think it's one of the things that Baylor does really well is making sure that their residents learn to be ready to practice on their own in entirety. Really strong support in the form of mentorship and assistance with finding fellowship and jobs that people want.
Yeah, I feel like we had a great experience seeing a high volume of patients all across different specialties, and worked with a lot of tertiary specialists, and just through seeing kind of how they managed patients was able to kind of extend that in this rural hospital that didn't have those specialist surgeons, but because I was familiar with them, was able to go above and beyond what a normal general surgeon in the United States would be able to do. But certainly all of the common general surgery issues, I felt very well prepared straight out of residency.
One of the things that I think is best about that program that you don't see at a lot of others is the variety of hospitals that you train at. There's very good exposure with a county hospital, an excellent level 1 trauma center. You have, the biggest VA in the country. You got an excellent children's hospital, an excellent cancer hospital, a high quality private hospital, and the exposure to the multiple different types of learning environments and multiple different hospitals that you could ultimately join, I thought was one of the best aspects of that program.
I felt very well supported with the group of chief residents I was coming out with. We were a pretty tight-knit group. And so I thought that I had great support from all the faculty there, and I didn't have any issues matching, which I think that just goes to credit what a great place Baylor is.
That's very difficult to get into. surgical residency, especially to a prestigious residency like in Baylor College of Medicine. But it's possible as long as you decide what you want to do and go for it.